my Catholic tradition, may she rest in peace, and may all of our loved ones, especially those who have suffered so unjustly in these times of COVID-19 and through the lack of care and concern of our own government, may they rest in peace.
The unprecedented health and economic crisis has demonstrated the dire vulnerability of all low-wage and gig workers in the United States. The experience of Black workers in the American South is not the exception to this rule, leaving them in a far worse predicament than at any other time in recent memory. The burden of bad policy in public health seems to have landed squarely in the same place as those of privilege and economic opportunity on the backs of Black and brown communities, largely in the South. For support, one need only refer to the racial blackness of the HIV/AIDS epidemic. Ample research shows that the blackness of this epidemic has been produced not by the behaviors of African Americans, but by conditions of structured racist domination. Racism, not race, ethnicity, or culture. Prior to the adoption of this scarcity model, HIV transmission has been understood to show the connection of careless sex and drug use as causes. These are politely named risk behaviors. The blackness of the HIV/AIDS epidemic has been considered a consequence of those actions. For Black Americans, however, I argue that the primary structuring factor that has determined risk of transmission has been what I call state intimacy, or violent intimacy of the racist state. From structured impoverishment to racial segregation, and from mass incarceration to the political death meted out to former prisoners, the state has structured the ways in which Black Americans have been made vulnerable to HIV exposure and transmission far beyond the capacity of any individual or community mitigation or control. This structured vulnerability entirely exceeds questions of so-called risk behaviors or their social construction. It is hard enough to respond to the challenges of a public health disruption when all things are equal. But since all things have never been equal for Black or brown communities in the United States, public health disruptions exacerbate the challenges of living to test the very levels of viability. Likewise, since the beginning of the National HIV/AIDS Strategy for the United States, the policy arm of the movement has struggled to address the societal and structural inequities that underlie the lives and livelihoods of Black and brown people from coast to coast. While HIV transmission and death rates declined in recent years, disparities still persist across race, ethnicity, gender identity, and geography. So as we go through this, let's think about the layers of being susceptible to infectious disease to begin with, and then what better health outcomes might look like. Blacks and African Americans make up only 13% of the U.S. population, but represent 42%, almost 50% of new transmissions. We have been told that the reason why these statistics are so much worse among Black citizens is because their behavior is so much more risky than any other population group. But the data and common sense do not support that theory. But this narrative is attractive because it places the blame on the people most affected and removes the shame from those who are perpetuating the narrative. Who's helping people of lower socioeconomic status in the South? Not conservative governors or legislators. As a result, even before an epidemic, basic health concerns are being neglected in the South, which over time leaves these communities susceptible to every virus and transmission that comes into the atmosphere. Lauren Berlant says this phenomenon can't be relegated to the margins of human experience by the label of crisis or trauma. Actually, what this is slow death by state policy. Berlant defines the experience of slow death as the physical wearing out of a population in a way that points to its deterioration as defining conditions of its experience and historical existence. Berlant exposes a state conspiracy to cover over or crowd out attention to the obvious lessons of these pandemic repetitions. Berlant says that the condition of low-income workers in the South is not defined by any particular trauma or crisis of an event or pandemic, but rather through gradual and everyday life in a slow death environment. If you want to ignore a population of people who are struggling with the scarcity of a crisis, All you have to do is wear out those people living in it. There is a routine and everydayness that overwhelms. Scholars often call a thing a crisis something that is an ordinary event. Our temptation to frame a tragic phenomenon in terms of crisis helps us stomach the disgusting reality in which many of our fellow Black citizens are forced to live. But the truth of the matter is that much of the deaths that we witnessed at the height of the COVID-19 pandemic was not death by sudden crisis, but slow death, exacerbated by bad public health policy. So it's not the particular crisis of the pandemic that we're most troubled by, but rather the conditions of life experienced on a daily basis, all of which became more visible with the COVID-19 crisis. These events include, but are not limited to, long-standing elements of police violence, systemic racism, societal and economic inequalities, and the increasing visibility of fascist policies. Between the emergence of COVID-19 crisis and the end of Donald Trump's re-election bid, institutional racism became evident with the murder of George Floyd, Breonna Taylor, and a number of other people of color by white police officers. Not coincidentally, the COVID-19 crisis also signaled an economic collapse that revealed degrees of poverty and suffering that were previously hidden beneath the rhetoric of liberal capitalism. The notes of critical pandemic pedagogy are central to this time in history. This perspective is crucial to understanding both the nature of the global crisis and what it means to rethink politics in the face of fascist regimes. A darkness has spread across the globe. Out of this period of uncertainty, new forces of change have appeared evident. COVID-19 has produced a climate of uncertainty, fragmentation, despair, and foreboding about the future. That is why I want to ground this conversation in the psychology of scarcity. Scarcity is the psychology that comes from not having enough. Poverty is the most obvious example. And throughout the decades, the social sciences have been impressed by the fact that the poor seem to make very bad decisions. And the question often asked is why? Well, it depends on who you ask. Some say it all flows from a lack of education. For some, it's a lack of understanding. And for others, they insist it's about a lack of foresight, bad cultural values, or even a lack of self-control. My support services practice team and I have discovered that it is effective to take a different tack on this. What emerges when you don't have enough can be very hurtful. To give you a sense of how this feels, think about your budget or your time or your health as a suitcase. With a large suitcase, you can toss in all the things that you need or might need, things that are of lower utility or much less important, but still might serve a purpose. Even after all of that, the larger suitcase still has slack for any unintended and unexpected events. But for the one with a very tight suitcase, it's so tightly packed that you can't even put in all the things that are necessary. It just doesn't fit, let alone the things that matter less. So now a struggle ensues. This person with the tight suitcase has to make trade-offs. What do they put in and what do they not? Should they put in the sneakers or the raincoat? Because there's not room for both. These trade-offs require a lot of attention and consume a lot of energy. The person with the slack suitcase cannot even comprehend how difficult life has now become. Living under scarcity is like traveling with a very tight suitcase. You're in a constant mode of trade-off thinking, and you have to consider the actual size or significance of items and what they all might mean for you. We're often providing healthcare and support services to people without health insurance or the resources to pay for services out of pocket. It's just like traveling with someone with a tight suitcase. Often, if I ask people in this situation, do you think about what you might not be able to buy when you have to purchase a TV or a toaster? They report thinking more about trade-offs than simply what they need to purchase, whether it's medication or even groceries. When it comes to our current healthcare system, the waste, cruelty, and dysfunction was glaringly obvious even before the horrific pandemic we are now experiencing. Today, as millions of people reflect on the loss of their jobs and their healthcare benefits that come with them, it is virtually now impossible for any rational person to defend the system. Even before the pandemic, cashiers made up a greater portion of Mississippi workforce than any other state in the country, according to the Bureau of Labor Statistics. They earn an average of $19,000 in annual salary, less than half the state's median household income, which would put a single mom with 2 kids below the poverty line. While Amazon used the Black Lives Matter logo in its anti-union literature, the fact remains that unions do more than any other organization to reduce racial and gender inequities on the job, and even daring to raise the question of unionization in the deep red right-to-work U.S. South. In November of last year, the city of Baltimore voted overwhelmingly in favor of establishing a permanent equity assistance fund that would be used exclusively to support efforts that aim to reduce race, gender, and economic inequality. The charter amendment that establishes the fund is one of the first in the country that explicitly mentions structural or institutional racism. A separate bill also obligates each government agency to analyze how it can address structural inequities to come up with an equity action plan. Poverty is one of the most hotly debated issues in the history of this country, but housing is healthcare. On January 26, 2021, President Joe Biden signed 4 executive orders designed to address racial equity in the United States. With one particular action, Biden hoped to right the historical wrongs Black folks have faced when it comes to housing and home ownership in this country. In this statement, the president directed the Department of Housing and Urban Development to take necessary steps to redress racial discriminatory federal housing policies that have contributed to wealth inequity for generations. If the city of Baltimore can take these steps, then so can every state in the union. Taking the steps to redress discriminatory health policy, though, is yet over the horizon. The us versus them polarization strategy that put Donald Trump in office turned a management crisis into a man-made disaster. All of this can be traced back to Trump administration's decisions to deprioritize the government's ability to respond to pandemics. At the time, the administration argued that the cuts were needed to streamline the National Security Council. But according to experts, the work of the Global Health Security Team is crucial to responding to any disease outbreaks. Since the federal government is sprawling and large, it helps to have centralized leadership in case of a crisis. The cuts, though, were part of a broader policy agenda focused largely on trimming the size of the federal government, proposing cuts to agencies like CDC and In the background of all these failures, the administration continued to push for several policies that, while not obviously related to coronavirus, experts caution would have a negative impact on the pandemic. For one, the president continued pushing for the repeal of the Affordable Care Act, as well as efforts to reel back Medicaid with work requirements. As another policy initiative, telehealth made a huge difference during the pandemic. This is a 21st century approach that is both patient-centered and protects patients, physicians, as well as others. State responses. The economic and education components were likely influenced by decisions made by policymakers, but it is unclear that that is the case for mortality. Pandemic mortality, finally, was greater in states where obesity, diabetes, and old age were more prevalent before the pandemic. In a 2017 experiment, researchers found that simply thinking about an expensive car repair bill significantly worsened the cognitive performance of low-income individuals. These same researchers also studied sugarcane farmers in India who make the majority of their annual income all at once. At harvest time, the farmers quickly go from poor to relatively rich. The farmers performed much worse in cognitive tests before the harvest when poor than after. Despite controlling for stress and other factors, the researchers concluded that poverty imposes a cognitive load and impedes cognitive capacity, and that these effects are equivalent to losing roughly 13 IQ points, comparable to missing out on a full night of sleep. This is an example of the scarcity mindset, a mental shift due to the perception of scarce resources. Our brains have limited bandwidth, so any attention afforded to one immediate problem cannot be used somewhere else. The scarcity mindset is not always a bad thing. It was once an evolutionary advantage. When early humans lacked essential resources like food and shelter, this mindset helped them focus on acquiring what was most important. Even today, it can help us concentrate on tasks in the face of deadlines. But the scarcity mindset makes escaping poverty extremely difficult. You can't invest in the future when your present needs are not met. Limited money and extreme focus on the short term make it hard to plan ahead. It's having to repeatedly buy cheap pairs of boots versus buying one expensive pair that will last you your whole life. While it makes sense at the time to buy daily necessities like food rather than pay bills, putting off those tasks ends up costing more in the long run when you have to pay late fees. People are not poor because they make bad decisions. People remain poor because poverty inhibits their ability to make good decisions. The effect of poverty and scarcity go beyond just the brain. The link between poverty and poor health is well established. And to guarantee adequate health care to all Americans, we have to fix the economic conditions that make them prone to sickness in the first place. Chronic stress, often the result of constant financial worries, puts millions of Americans at increased risk for a litany of preventable illnesses like heart disease, depression, weight gain, and more. Furthermore, kids who grow up in poverty suffer from the consequences their entire lives. Child poverty can impact brain development, which may lead to mood disorders such as depression and substance abuse later in life. In the United States, children in poverty have lower standardized test scores, are more likely to drop out of school, and are less likely to go to college. But there's an important but hard to measure effect on our communities too. When we feel that money and goods are scarce, we start to think of our neighbors and fellow citizens as competitors rather than teammates, united by our shared humanity. When we believe that the economy is zero-sum, we also come to believe that helping another person comes at our own expense. Helping our fellow humans escape poverty, debt, and misery becomes a disservice to the wealthy, rather than an expression of compassion and justice at the foundation of a society of equally free and valued people. The United States is more than capable of establishing a universal basic income, a monthly payment to all citizens sufficient to meet their needs. This proposal could virtually eliminate poverty overnight and start shifting our collective mindset from one of scarcity to one of abundance.